Welcome to your program of choice, Health Affair, a platform where we focus on public health challenges, issues about women and children with a view to finding lasting solutions. I am your regular uncle, Shomowa Daniels. Our focus today is on body enhancement, with examples like hip augmentation, breast and bone enlargement, and what people think about it. We'll be right back after our new segment.
Over 100 residents in Lagos State benefited from the free medical intervention carried out by family doctors to commemorate the 2023 World Family Physicians Day. Their magnanimous gesture was indeed a true reflection of the theme, Family Doctors, the Heart of Health Care.
It covers people that have a breast lump, people that have hernia, people that have lipoma, people that have ganglion, people that have ingrown toenail. Those are the ones we call day cases. And those day cases, what they mean is that those cases you can do, the patients you can operate on, and they go home the same day. This is the first of its kind. Healthcare is everybody's business. It is not for government alone. And whatever you can do, do it. Darkness can never disappear by cursing, not just praying. That is not trying to reduce the potency or the usefulness of prayer. But even the Bible says, faith without work is useless. So that shows that you need to take steps, you need to take action. So what do I encourage people to do? Help as much as you can. Light a candle at your corner, and darkness will disappear.
80% of disease conditions are being seen by the family physician. 80% of the time, they are the ones that see these disease conditions. And that helps us to know that the family physician has a major role to play in ensuring that the universal health coverage is reached.
Professor Akin Abayomi, the immediate past Commissioner for Health, was also there to give support and admonish residents on the importance of health insurance.
Family medicine practitioners are skilled and trained to do simple surgical procedures, thereby saving lives and, of course, saving a lot of resources to the patients. So we're very delighted with the changes in the curriculum in the family medicine training. It's a very long training. They've extended it now to make sure that they can include some of these skills into the graduates to serve the citizens as we roll and task shift, and we are trying to address the situation of brain drain. We are promoting that you buy the Ilera Eco. For one individual, it's 8,500 naira. That's health for a whole year. For a family of 6, it's 40,000 naira. Once you buy that insurance, you can walk into your medical facility and get health free of charge.
May 17th every year is World Hypertension Day, a global event to raise awareness about the disease and how people can prevent it. And for those already living with it, adopt healthy lifestyle to live longer. Several days after the event, experts at the West African Postgraduate College of Pharmacists in Nigeria are still carrying on with the Enlightenment campaign. They carried out an awareness talk and medical intervention for traders and residents at Sabo Ultramodern Market at Yaba. Hypertension has become a global medical health emergency, with over 1 billion persons across the globe suffering from hypertension, a figure likely to hit 1.5 billion by 2025, with developing countries like Nigeria contributing a greater percentage.
If you don't take care of it also, it can also lead to eye disease, because even your eyes need blood, and if there is high blood pressure, then your eyes will not get enough supply of blood. Some people, they will not be seeing well again. Some people, their eyes can go blind because they didn't treat their BP. So you see that it's very important that we take care of our high blood pressure and bring the numbers.
Speakers at a recent conference of women laboratory scientists in Lagos have called for greater collaboration for more women to rise. They noted women were the enemies of one another in most workplaces and thereby hindering their career growth.
We have identified the characters, the profile that is needed as female medical laboratory professionals to be able to contribute to the nation building. And we also identify some challenges. So in my recommendation, apart from looking at those challenges, it's also important that the government establish a medical laboratory science department, a full-fledged department in the Federal Ministry of Health that relates directly to the minister.
Conference today, as the team goes, is for us to know what the female professionals are going through and their importance in medical laboratory practice. You can agree with me that a lot of medical laboratory scientists, technicians, and assistants, even medical doctors, they are all moving out of the country because of the situation in the country today. And it's actually affecting the practice here in Nigeria. So we are bringing this conference down today to let our colleagues in this profession to know that it is important for us to practice here in Nigeria and what we live to gain.
What we desire is for women to join hands together, to stand together, to fight together, to love each other. We are tired of this tearing ourselves down instead of building ourselves up. Hence, we did this conference. We made this possible so that we can talk to ourselves. We can sit down and say, okay, how is it doing? What is hurting you? Where do you need help? How can I be of help? Do you need a shoulder to cry on? Do you need a shoulder for us to pray with you? That kind of togetherness and empathy for one another is why we are here.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant information. The sorry state of our health infrastructure has also been a major challenge. On Health Affair, Oshomoa Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through quality information.
I work for USAID funded Breakthrough Action Nigerian project, and I'm asking you to watch Health Affair because it is an authentic platform for health information.
TB is a chronic infection caused by Mycobacterium tuberculosis. TB has symptoms like cough of two weeks duration, weight loss, night sweat, hemoptysis, fever, and chest pain. TB can be prevented. TB is curable. Taking your drug for 6 months, you'll be free of TB. You'll be totally free of TB. And lastly, the diagnosis and treatment of TB is free.
Welcome back. Now to our topic on body enhancement and what many people think about the medical procedure.
One of the reasons why people, especially celebrities, go outside to access these implants or augmentation is as a result of a decrease in their self-worth. You understand? So they don't really have self-belief that their body parts are adequate. So in order to get the appropriate body part size, they seek health care to secure some form of augmentation in the form of implants. So these implants, over time, even in Nigeria, some do it in Nigeria, some do it outside the country, they are foreign bodies. So when implanted, they have some side effects which they can cause in such people. One, implant surgeries have been discovered to be associated with high risk of infection. So infection is one of the things. And infection, when it sets in, can overwhelm the person depending on the presence of other comorbidities, like diabetes. Maybe, for instance, if the person is diabetic initially, or maybe the person has a retroviral disease initially, or the person has a cancer initially, and the person seeks for an implant, then the implant causes an infection. The infection will cause overwhelming sepsis. So some of them die as a result of the overwhelming sepsis that sets in after using the implant. Then some of them do die of depression too, because some of these surgeries are not successful at the end of the day. After using the implant, maybe they will now have what you call body dysmorphic syndrome. The part of the body will now become deformed instead of giving them the results they were seeking for. Then that's basically some of the complications that can come up
after using implant surgeries. Also, we cannot talk without listing the other complications that are common in other surgeries, because every surgery, at least they will use anesthesia. Anesthesia is a substance, a chemical substance they use so that one does not feel pain, or maybe is not aware when the surgery is ongoing. So some people react to it. When it is overwhelming, patients do die from it too. So these are some of the things that can happen. Then after the surgery, during the surgery rather, there can be a lot of bleeding too. Some people die from bleeding. You understand? Maybe they have a baseline or let me say familial bleeding disorders. So when the incision is made, they might bleed out from there, or they might die as a result of the sequelae after the surgery, which is the period after the surgery, because surgery is seen as a hit. Let me describe what I mean by a hit. After surgery, some inflammatory processes set in, such that the immune cells in the body, they start producing some substances that might cause fever. So the patient that just had surgery in the early phase might start having some things that will look as if he's sick. You understand? So when this becomes overwhelming, the patient can die from it. The patient can die from them. So that's the first hit. So these are some of the complications. But some of the implants they use, as you mentioned one of them, silicone. They can also do it without implants. It depends on if it is the breast. They mobilize some muscles to do the augmentation. Some muscles close by in the body. Then if it is the bum, that's where they use implants. They can use chemicals to inject. These chemicals, instead of causing the necessary augmentation, might cause necrosis, that is death. In macroscopic, when it is seen, that is the one you can see, you see the bum will start decaying. That is the gangrene of the bum, something like that.
To attract more men, to trend, to look more gorgeous. They claim it makes them look beautiful and all that. Well, it's a personal opinion. If you feel it makes you look good, if you feel it makes you look better than the way God created you, your luck. But I don't think it's going to impress all men. Personally, I don't really fancy it, and I will not advise a woman to go do anything to enhance her body, because in the process anything can happen that could harm you, and it's not worth it. If a guy likes you, he will like you the way you are, and every lady and every person is beautiful the way they are. So what's the essence of enlargement and enhancement? So I don't fancy it.
I think it's ungratefulness. You know, you have to be grateful for who you are, for what God created you to be. Because when you look at the crippled, those people in wheelchair, would they be talking of bum or big breast? You know, they won't be talking about bum breast or any other thing of enlargement. They will be like, Father, if only you can let me walk. You understand? It's ungratefulness. Once you are grateful, Father, thank you. And you look at yourself in the mirror, appreciate yourself and say, Father, thank you for creating me like this.
My wife does not make up. She keeps her hair, she plaits it natural, she doesn't apply anything artificial. So she will never even think of that, talk less of me. So there's nothing like artificial enlargement or whatsoever. Any lady that is doing such thing, you are abusing, number one, you are abusing your nature. Secondly, you are telling God is not capable, God is not wise. So whatever you have, no matter how small or how big it is, just take it like that. God knows why he makes you like that.
You should live luxurious life the way God created you. What is the need of doing surgery? Even these high brand women are facing, like myself, personally, I don't like it. Like they are challenging God. You live yourself the way God created you. I think it's the best way. There's no need of doing surgery. Something you know is harmful to your life. Why are you doing it? So the best thing, live the way God created you. You eat good things, good food. Take good care of yourself. It's not by doing surgery or by cutting yourself that will make you to be a beautiful woman. If you are a natural woman, any man that see you as a natural woman, he will love you. Not by doing surgery or harming yourself. It's dangerous.
No, it's worldliness. No, I saw it as a worldliness. So they don't need to actually try to reshape themselves and so on.
It is a sense that we do not appreciate who we are and what God created us to be.
It's important for parents to raise children who are comfortable and confident in themselves.
It's really very sad that people are not comfortable with what they have. I think it's a kind of inferiority complex.
When people are not properly educated, they take wrong decisions. They learn from friends or other people who do not even have the right information. And the greatest source of information, I believe, is from our parents. I don't think that a mother would tell the daughter what is wrong, except the mother does what is wrong. Then they will give the right information. And when they are properly educated, they will do the right thing.
If you are just joining us, it's Health Affair on AIT. Next on the program is our nutrition segment, an aspect of the program where we extract different food items, fruits and vegetables, and how they help human nutrition. Milk, according to health and nutrition experts, is a food that contains a lot of healthy nutrients needed by people of all ages. The many misconceptions about milk and many of the substandard products imported into the Nigerian market has denied majority of the population of the healthy qualities inherent in the consumption of the product.
80% or not less than 80% of the milk that we have available today are imported to Nigeria. And you can imagine if we have 50%, even at least 50% of milk that we drink in Nigeria, they are produced within the country. How many people are going to be employed? A lot of children are going to live healthy. A lot of adults are going to live healthy. A lot of youth will get employment.
The occasion of the 2023 World Milk Day with the theme, Heart Healthy Milk, Nutritional Foods and Livelihoods, provided another opportunity for experts to focus attention on actions aimed at feeding the population with low saturated fats and low sodium diets.
Make milk a necessity in their daily food. Everybody needs calcium, they need all the essential nutrients which are present in milk for their growth.
We should take heart-healthy milk. Heart-healthy milk is milk that is low in saturated fat. Heart-healthy milk is milk that has zero content of trans fat. Heart-healthy milk is milk that has low salt. Heart-healthy milk is milk that has low sugar.
World Milk Day is an annual event celebrated on the 1st of June every year to raise awareness about the importance of milk and dairy in maintaining healthy diets. Oshuomowa Daniels, AIT News, Lagos. On our clinical segment, we give you tips for healthy living.
My name is Okwiagbeko Teniola. Hygiene to me means taking care of yourself, not just yourself, but your environment and everyone around you, because people around you influence who you are. So I suggest that everybody around you should be clean, tidy, because if they are dirty, you also be dirty. Even if they are not dirty physically, you'll be dirty morally, anyhow. We should do sanitation, we should spread the word that prevention is better than cure. We should practice hygiene more efficiently, so I will not be, because the rate at which hospitals are demanding bills for diseases are going high, and they're escalating every day. So I suggest that we should sweep our surroundings and just be clean.
My name is Oyebade Temiloluwa. Okay, hygiene is the state of keeping yourself clean in order to eliminate diseases or germs. Maintain hygiene by keeping not only ourselves clean, but keeping our surroundings clean and making sure that everything we have around us is clean.
My name is Otubu Heritage. Cutting your nails, brushing your teeth well, and taking your bath to avoid diseases. Maybe the government can make pad, menstrual pad, free and available for some girls, and also give girls, those who have menstrual issues, give them free hospital bill.
My name is Ekinete Milulua, and to help a girl child during a menstrual period, government can produce free menstrual pad for girls, because we have lots of
people that can't afford pad, and there's no our family will always have a girl child. So government can produce free pads for those people.
My name is Akela Luatosin. Hygiene is a way of taking care of our body, the parts of the body, our environment, our society, just to make it clean and not to contact germs. By washing your hands, by cleaning your environment.
This is how we wrap it up today. Thanks for spending your time with us. Join us same time next week on another interesting edition of the program. And don't forget to advertise your health products and services. We do it for you at a subsidized rate. I am yours truly, Ushuomowa Danis. Please keep staying safe.